Sickness and symptoms. Do you know how to describe what's wrong with yourself when you go to the doctor so that you can get the proper treatment and feel better? Today, we're going to talk about sickness and symptoms. First, let's talk about symptoms. A symptom means what is wrong with you. What's the matter? What seems to be the problem? This is what the doctor is going to ask you when you go to see them. Number 1, cough. Cough. You can say, I've got a cough. I've got a cough. Or, I cough a lot. I cough a lot. You should wear a face mask if you have a cough. Number 2. Achoo! Sneeze. Sneeze. You can say, I've got to sneeze. I've got to sneeze. Or, I sneeze a lot. I sneeze a lot. Don't forget to cover your mouth when you sneeze. Then wash your hands. Number 3. When your nose is all wet and it just keeps dripping, you have got a runny nose. You can say, I've got a runny nose. I've got a runny nose. You need to blow your nose a lot. Number 4. If your nose feels really tight, like this, it's difficult to breathe, you can say, I've got a stuffy nose. I've got a stuffy nose. Number 5. This is your throat. If your throat hurts, you have a sore throat. You can say, I've got a sore throat. I've got a sore throat. It hurts when you talk or swallow food. Number 6. If your forehead is so hot, you have a fever, or some people say a temperature. You can say, I've got a fever. I've got a fever. Or you can say, I've got a temperature. I've got a temperature. We measure our temperature with a thermometer. Thermometer. You should stay home and rest if you have a fever. Have you ever felt like the room is spinning? How would you describe this feeling? Number 7. You can say, I feel dizzy. I feel dizzy. Or, I feel faint. I feel faint. If you actually do pass out, you can say, I have fainted. I have fainted. Or, I have passed out. I have passed out. Or you can say, I have lost consciousness. I have lost consciousness. This is a more difficult one. Number 8. When you are coughing and sneezing, and you have got a sore throat and a runny nose, you probably have a cold. You can say, I've got a cold. I've got a cold. Or, I've caught a cold. I've caught a cold. The flu is much worse than a cold. You can say, I've got the flu. I've got the flu. Most people just say the flu. It is actually short for influenza, which is a type of virus. People usually have a fever if they have the flu. Number 10. If you eat the wrong kind of food, you may feel like you're going to be sick. You can say, I think I'm going to throw up. I think I'm going to throw up. Or, I think I'm going to vomit. I think I'm going to vomit. Number 11. If you eat some food that is not clean or not fully cooked, you may get food poisoning. You can say, I've got food poisoning. I've got food poisoning. Number 12. If you have got food poisoning, you will need to use the bathroom many times because you have a diarrhea. A diarrhea. Number 13. This one happens to people a lot, especially if people are working on the computer or sitting for a long period of time. They get pain in their shoulders or neck. You can say, I've got stiff shoulders. I've got stiff shoulders. Or, I've got a stiff neck. I've got a stiff neck. When you are in pain, there are a couple of things we can say with the word ache. Ache. Number 14. When your head hurts, you can say, I've got a headache. I've got a headache. Number 15. When your tooth hurts, you can say, I've got a toothache. I've got a toothache. Number 16. When the inside part of your ear hurts, you can say, I've got an earache. I've got an earache. Number 17. When your back hurts, you can say, I've got a backache. I've got a backache. Number 18. When your stomach hurts, you can say, I've got a stomachache. I've got a stomachache. Number 19. We can also use the word sore. Sore. When your eye hurts, you can say, I've got a sore eye. I've got a sore eye. Number 20. We've talked about this. When your throat hurts, you can say, I've got a sore throat. I've got a sore throat. Number 21. If you have run for a long time and your knee hurts, you can say, I've got a sore knee. I've got a sore knee. Number 22. If you bang your hand on something and one of your finger hurts, you can say, I've got a sore finger. I've got a sore finger. Number 23. Sometimes your skin gets very itchy and you need to scratch it a lot. Maybe you have a rash. So you can say, I've got a rash. I've got a rash. Number 24. Do you have this kind of problems? I start sneezing every time there is a cat nearby. If I touch the cat, I will feel really itchy. That is because I am allergic to cats. I am allergic to cats. Or I have an allergy to cats. I have an allergy to cats. Number 25. If you have got measles, you will get red spots on your skin and you will have a fever. You can say, I've got measles. I've got measles. Doctors give you advice to help you get better. Some common advice include Take some medicine. Take some medicine. The doctor will tell you how often you should take the medicine. For example, take this medicine 4 times a day. Take this medicine 4 times a day. Take this medicine with food. Take this medicine with food. That means you need to take the medicine after eating. Sometimes the doctor will tell you to take the medicine before eating. They will say, take this medicine on an empty stomach. Take this medicine on an empty stomach. This medicine will make you feel drowsy. This medicine will make you feel drowsy. Do not drive after taking the medicine. Drowsy means sleepy. If you have got a cold, the doctor will also tell you to drink plenty of water. Drink plenty of water. Sometimes the doctor will tell you just drink plenty of fluids. Drink plenty of fluids. Fluids mean liquid. Some fluids that you can drink when you are sick include soup, milk, juice, and honey water, especially when you have a sore throat. Getting plenty of rest can also help you to get better. If the doctor wants you to get plenty of rest, they may suggest you not to go to school. They may say, stay home for 2 days. Stay home for 2 days. A lot of you are afraid of this one. If you have a fever, the doctor may suggest you getting an injection. Getting an injection. If you have a rash, the doctor usually tells you to apply some cream on the rash. Apply some cream on the rash. If you have a sore throat, the doctor will also tell you not to eat any oily food. Eat some plain congee. Eat some plain congee. Now, let's watch a video between a patient and a doctor.